Have you ever felt lightheaded when standing up? Maybe it happened so quickly, you just brushed it off. But what if I told you that brief dizzy spell could be your body's way of warning you about something serious? I'm Dr. Elliot Graves. For more than 30 years, I've worked as a geriatric physician, caring for adults in their 60s, 70s, 80s, and beyond. And over the years, one of the most dangerous things I've seen isn't cancer or heart attacks. It's something that hides in plain sight, a small, silent shift in blood pressure that can turn your entire life upside down. Today, I want to show you exactly why this matters. Because more than 100,000 older adults are rushed to the hospital each year because of it. Most had no idea what was really happening until it was too late. Let me walk you through this condition, how to spot the earliest signs, and 5 simple things you can start doing right now from the comfort of your home to protect yourself and your independence. So let me ask, have you ever stood up from bed or a chair and suddenly felt the room spin for just a second? Maybe you had to grab onto something to steady yourself? That could be more than just aging. Let me tell you about my former patient, Martha. She was 73 and full of life, a retired librarian who spent her mornings tending to her rose garden. One day, during a regular visit, she told me she'd been feeling a little funny when getting out of bed. She said, "It's probably nothing. I just moved too fast." 3 weeks later, she fainted while walking to her mailbox. She fell hard and broke her hip. That single fall changed her entire life. Surgery, rehab, weeks without walking, and a sharp loss of independence. All because of what she thought was just a little dizziness. That little warning sign? It had a name. Doctors call it orthostatic hypotension. But you don't need to remember the medical term. What matters is what it does. It's a sudden drop in blood pressure when you change position, usually from lying down or sitting to standing. That drop reduces the blood flow to your brain, causing dizziness, lightheadedness, or sometimes even fainting. And it happens far more often than most people realize. Have you noticed this happening to you? If you have, stick with me. This could be the most important health advice you hear this year. So why is this condition more dangerous after the age of 60? Well, as we age, the systems in our body that regulate blood pressure, the ones that respond to movement and gravity, begin to slow down. Imagine an old thermostat that takes too long to adjust the temperature. That's what happens inside your body when you stand up. It simply can't respond as quickly as it once did. Now add something else into the mix: medications. Many older adults are on multiple prescriptions, blood pressure pills, antidepressants, medication for Parkinson's, or even basic sleep aids. These can all increase the risk of a sudden blood pressure drop. I'll never forget Theodore. He was 81, a retired high school teacher with a warm laugh and a bookshelf that spanned an entire wall of his living room. He came to me complaining about random spells of fogginess. After reviewing his medication list, which had grown to 8 different prescriptions, we made a few careful changes with his primary doctor. The result? His dizzy spells dropped by more than 70%. But there's more to it. A brief moment of dizziness might not seem serious, but it can trigger a dangerous chain reaction. One fall leads to an injury. An injury leads to less movement. Less movement leads to muscle loss. And suddenly, that minor symptom has taken away your ability to live on your own. Has that ever happened to someone you love? Maybe a parent or a friend? That's why we can't ignore these signs. Now, let's figure out how you can know if you're at risk. Do any of these sound familiar? You feel dizzy, lightheaded, or see spots when you stand up from a chair or couch, get out of bed in the morning, stand for long periods, like at church or in line, stand up after bending over to pick something up. These symptoms might last just seconds, or they could stretch into minutes. Sometimes you may even feel weak, nauseated, or mentally foggy. Beatrice, one of my patients, was 68 and full of charm. She loved to paint, but during a checkup, she told me that after standing up from her garden bench or dining table, she'd feel a strange cloudiness. That caught my attention. Sure enough, her blood pressure was dropping by nearly 40 points when she stood up. No wonder she couldn't think clearly in those moments. So let me ask again, have you noticed a pattern when your dizziness happens? Taking a moment to write down when and how often you feel off balance could make a huge difference when you speak to your doctor. Don't wait for it to become a fall. Now let's talk about the hidden causes of these blood pressure drops, and more importantly, what you can do about them. There are four main culprits I want you to know. First, dehydration. You might not feel thirsty like you used to, and that's completely normal with aging. But even mild dehydration can make your blood pressure plummet when you stand. Some older adults even avoid drinking water to limit bathroom trips, especially at night. But this small sacrifice can lead to a big problem. Second, medications. We already talked about this, but it's worth repeating. So many medications can increase your risk of dizziness. Please don't stop taking anything on your own, but do schedule a review with your doctor or pharmacist. Ask, could this medicine be lowering my blood pressure when I stand up? Third, prolonged bed rest. If you've been sick or hospitalized recently, your body may not bounce back as quickly as it used to. I remember Gerald, a 74-year-old jazz lover who had been in the hospital for pneumonia. Once he was back home, he felt lightheaded every time he got out of bed. His body had to relearn how to adjust his blood pressure properly, and it took weeks. And fourth, chronic health conditions. Things like diabetes, Parkinson's disease, and certain heart problems can interfere with your body's ability to stabilize your blood pressure. If you live with one of these conditions, this information is especially important for you. Now, the good news is this. Once we understand the cause, we can take action. So here are 5 simple steps you can start right now to reduce your risk, and they don't involve fancy treatments or expensive devices. 1. The stand-up strategy. I call it the 30-30-30. When you wake up, sit on the edge of the bed for 30 seconds. Then place your feet on the ground and sit there another 30. Wiggle your toes, flex your ankles, move your calves. Then stand slowly and wait 30 more seconds before walking. That's just 1.5 minutes, but it gives your body time to catch up. Florence, one of my favorite patients, started doing this every morning. She lived alone and was terrified of falling. This routine gave her confidence, and after a few weeks, she told me, I don't feel that rush to grab the nightstand anymore. 2. The hydration habit. Try to drink 6 to 8 glasses of water per day. I know that's easier said than done, so here's a trick. Place a glass of water in the places you visit often: the kitchen, the nightstand, the bathroom sink. Each time you pass by, take a sip. Victor, an 82-year-old former baker, made it a rule to drink a glass of water with each meal and one with his morning pills. That alone cut his dizziness episodes in half in just 2 weeks. 3. Compression stockings. These apply gentle pressure to your legs, helping blood return to your heart and brain. Sophia, a 76-year-old artist, thought they'd be uncomfortable, but once she found a pair that suited her, she noticed a big difference in her energy and balance, especially during her art shows. 4. Salt, but with caution. Some people may benefit from a slight increase in salt to help keep their blood pressure stable. But this only applies if you do not have high blood pressure or heart failure. Always talk to your doctor before making any changes to your diet. 5. A medication review. Bring all your medications to your next appointment, including supplements. Ask your doctor, can we check if any of these might be causing my dizziness? You'd be surprised how often a small adjustment like changing the time of day you take a pill can make a huge difference. Just like Ruth, she was 84 and taking her blood pressure medication at night. By moving it to the morning, we nearly eliminated her dizzy spells. So let's bring it all together. Those dizzy spells when you stand up, they might seem minor, but they could be a sign of orthostatic hypotension, a condition that becomes more common after 60 and far more dangerous than people think. It happens when your blood pressure drops suddenly as you move from sitting or lying down to standing. And that quick drop can starve your brain of the blood it needs, making you feel lightheaded, foggy, or weak. We've talked about the biggest warning signs: dizziness when standing, feeling faint after bending down, seeing spots or feeling foggy when getting out of bed, weakness or nausea after standing too long, and we've talked about what causes it: dehydration, certain medications, being in bed for long periods, underlying conditions like diabetes or Parkinson's. But most importantly, you've now got 5 practical ways to fight it. Stand up slowly with that 30-30-30 method. Stay hydrated every day. Use compression stockings if your doctor approves. Talk to your doctor about salt, especially if you don't have high blood pressure. Review your medications for possible side effects. When you combine these small steps, they work together to protect you not just from falls, but from the loss of independence that often follows them. And here's what I want you to remember most. You don't have to do all of this at once. Even if you just start with sitting on the edge of the bed for 30 seconds, you're already helping your body adjust and prevent a dangerous fall. Getting older isn't about giving things up. It's about getting smarter with how we live so we can keep doing what we love on our own terms. Have you tried any of these strategies before? Or have you noticed times when your balance feels off? I'd love to hear your story in the comments. You never know, something you share could help someone else in our community feel seen, supported, or even safer. And if you found this video helpful, consider subscribing to the channel. Every week I share tips and stories from my 30 years in geriatric care, things that can help you live stronger, longer, and more confidently. Now, here's something I want you to watch next. In my upcoming video, I'll show you a very common posture mistake that drains your energy and contributes to fatigue. Just a small change in how you sit and stand could help you feel more alert and even reduce daily aches and pains. So until then, stay steady, stay hydrated, and take care of yourself.